Maybe if they're eligible for SNAP or they're eligible for the distributions, right? We're not going to be the long-term food provider, but we can help address those needs.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really great guest today coming from Ohio. I have a lot of great colleagues in Ohio there. Director of Community Health, Tyler Smith. Tyler, please introduce yourself and the role, and then we can have a great conversation about the awesome work you're doing.
Yeah, absolutely. I'm glad to be here today, Cole. Thanks for having me on. So Tyler Smith, Director of Community Health for Mercy Health Lima, which is St. Rita's Medical Center. So in this role, I've been here for 5 years in this role, and really what I do is I lead the strategy of our community health needs assessment and our community health improvement plan. So what I see as really my overarching goal is really kind of to extend the resources and to extend the care beyond the four walls of the hospital. So we serve an 11 county region. There's really, for my role, 3 counties that I really focus on from a preventative and outreach standpoint. So really, it's my job to work with, our health departments, our nonprofits, various sectors in the community, understand kind of what the gaps and opportunities are. What are some of the health challenges, right? What are some of the priority populations who are most at risk for health disparities? And then what I do is I kind of build a strategy around that to identify some of those needs, build programming at the hospital level, and then also programming from an outreach standpoint. In addition to that, I also oversee all of our community benefit reporting. So since we're a nonprofit 501c3 hospital, I also oversee that as well. And just kind of make sure that all of our investments are kind of in alignment to identify needs within the community from a health standpoint, and it's reaching the populations that it needs to.
Nice. That's impressive. That's impressive and very important work. When we talk about your population that you're serving, just so that we can have context, are we dealing with an urban, suburban, rural mix? What does it look like?
Mixed. Yeah, so the hospital is right here in Lima, which is probably a city over, I don't know, 35 and 40,000, mostly urban. However, the county that we're in is at about 100,000, so it's a good mixture of urban and rural. And then when we think about the counties all around us, they're all rural. So it is very different because there's a lot of things that we have to be very strategic on from an outreach standpoint of things that we do in Lima. May be different than something that we do like in Ottawa or something in Allglaze County or more rural area. And we have to think about that differently because that population is going to react differently, right? They want different things as well. And so, but yeah, I would say our population is really mixed.
And that can make it challenging.
Hmm.
That makes it tough.
Yeah.
What are some of the biggest challenges that you're seeing with the population there? What are you running into as difficulties?
So really, when we think about like things that I focus on, I mean, it's pretty broad, but you think about maternal infant health, right? Chronic disease management, housing and community conditions. You think about the mental health, substance abuse, and some of the access issues. Maybe that's food insecurity, providers. I would say some of the things that have bubbled up even more so, like within the last 2 or 3 years, would be challenges around housing. There's been a lot of challenges around housing. Also, within the last year and a half, we've seen an influx of what we call newcomers. So our immigrant and refugee population, we've had a lot of Haitians that have moved to the Lima area. And so that creates some challenges because from a healthcare standpoint, right, you need to have translation set up, and they also present a lot some different cultural backgrounds and different health needs as well. And so, but I would say a lot of the social barriers, so transportation, housing, access to providers. You think about food insecurity. I mean, those are some of the things that I think have even escalated more so, especially with how kind of the economy has been over the last couple of years.
As a health system, how do you address issues like housing? And because there's a
Mhm.
debate too about this, right? Some people are saying, hospitals shouldn't, participate in trying to fix issues like housing, but then you end up seeing higher costs because you got people coming to the ED at, more frequently.
Mhm.
So there's both sides. So how are you addressing issues like that?
Yeah, I'm glad that you mentioned that. So, literally, where our hospital sits on that property, there's a neighborhood just north of us, and so We look at data at a census tract level. We've realized that there's a lot of pockets, right, and may present some different disparities, and you have a bunch of different factors that are coming together that may present a challenge for somebody to access us or seek us out. And so the neighborhood that's just north of us, it's Census Tract 129, but we have made significant investments, um, really over the last 2 or 3 years around housing. And so one of our goals is to just to kind of paint the picture within that census tract, and it maybe 2 or 3 years ago, 65% of those occupants were renters, and about over 50% of them were extremely rent burdened. So you have about, that percentage of them that are spending more than 50% of their income on rent. So they don't have the other money for prescriptions, for food, right? Some of those other things, and they may not be worried about managing their chronic conditions. So we actually work together with a couple, one of our economic development partners here, a couple other nonprofits and business partners to essentially kind of form an LLC. And so we are actually working we got investments to provide, basically to allow those folks to become homeowners, to provide opportunities to improve, the affordability and make improvements to their housing. So like working with the Habitat or, other nonprofits here in Lima that, could provide like utility assistance or any of those things. And so that's been going really good. And then we've been really fortunate to get some other large grants from Ohio Department of Health to specifically do work like to provide wraparound services, to provide opportunities kind of to decrease that access to care, because that census tract is an opportunity zone. And so,
So there's extra grants in those
yeah,
opportunities. Is that how that?
yeah. So the grant's called the OHIS grant, Ohio Health Improvement Zone grant. And so we were actually able to hire a resource navigator who we contract with. She actually lives in the neighborhood, runs their neighborhood association. So we've propped up programming over the last couple of years. For example, like a walk with the doc. Um, we've created a green space there on site. We have annual health events there where we have our partners from the hospital and different service lines that come out and do screenings, and community partners there. Um, what else we've done? Homeowner type classes and events there, bringing realtors on site, working with the local banks, doing financial classes to essentially get them to the point where they could become homeowners. So we've really been doing a lot of educational events of bringing them on site and talking about different service lines and what we have available, and it's been really, really successful. So that's just one example when you talk about housing.
How do you get things started like that? Because I feel like there's compliance challenges. There's of course financial, but then you're going to have, I mean, a lot of questions from leadership as well. So
Yeah.
how do you get that started? Like, what's the first step that you took?
Yeah, that's a great question. There was already a larger task force within Lima that our mayor had started, kind of bringing together a bunch of those leaders in the community of saying like, hey, we need to tackle some of these challenges. And then from a system level for Bon Secours Mercy Health, and kind of my colleagues and the directors community health for all the other markets, we had an opportunity then where we were basically as a partner of the Health Anchor Network. Part of that is investment in kind of being an anchor institution and basically identifying the greatest need within your market, right? And so housing was one of the greatest needs. And so we had an opportunity um, to basically have access to some investment dollars that we could kind of put back into the community. But we then had to identify some partners who could kind of help operationalize it, and bring that together. So that's kind of how it started. It obviously, we had to talk about it a lot, right? Kind of get our leadership on board. Our leadership at the hospital is amazing, so they see that, they understood the need, and then it basically from that standpoint, you just kind of matriculated into opportunities for grants, more funding, right? More opportunity to provide resources there, whether that's like FTEs or programmatic support. But then it also kind of developed as a goal for our community health improvement plan. So it's something that we're measuring, right? So we bring all these folks together quarterly around a variety of different health goals and strategies, and housing and community conditions is one of our priorities. So we have specific strategies that we measure, we submit, um, and kind of go from there. So yeah, it's definitely kind of etched into a lot of the work that we do.
Is that community health improvement plan, is that a mandatory thing from the government, or is that something that you guys are just doing? How does that, what does that look like?
Yeah, so yes, all hospitals, nonprofits have to complete that. In addition, like all health departments do that as well. And so there's a different cycle. We would complete a health needs assessment, which is essentially provides the groundwork for it's kind of like the data, right? It's kind of collecting all the primary, the secondary data, identifies what resources, what's the capacity within your area to kind of address some of those needs. And then the chip is essentially um, after you bring a bunch of stakeholders together and identify what those priorities based off of the data is telling you, then you kind of put together your strategic plan. So your community health improvement plan is a 3-year strategy. So yeah, we had to submit all of our for the 990 when we submit our tax documents, the chip and all of our measures get reported out on that as well.
And so this is a pretty important.
Yeah, so it's something that we measure. Our board approves it.
Yeah.
Frequent updates, and then like I said, the health departments do one as well. So that's what that looks like for us is I work very closely then with our 3 counties that is kind of like our primary service area. I work with their health department and then that's how we partner and say, hey, well, we're doing this, right? Maybe financially we can support this here within Putnam County, or maybe we have a family medicine practice here and we'd like to implement some sort of programming here for this population. And so that's what I kind of get an opportunity to be very creative and strategic to understand kind of be like that dot connector of, hey, we got so and so here, right? This program already exists. Let's not recreate the wheel, but let's think about strategically how we can do this, do it better. How can we align this back to, from a clinical standpoint, back to the hospital? And so that's, but yeah, I make sure that I partner with our health departments on that. And then they're actively involved when we have our quarterly meetings and stakeholder input, right? We take in consideration like all the data that we've captured from surveys or events throughout the year. We kind of compile that and also the data that we have from like an ambulatory standpoint and inpatient as well.
How does that work? When you said something there about reinventing the wheel, how does that work when it comes to our newcomers? Because, uh, you know, of course, one of the big issues I'm assuming is going to be housing for people who are just getting to the country. But um, you just talked about how we have a program that's established, it's working well. Are we seeing any synergies there between the newcomers and the housing programs you have?
Yeah, so we really kind of took a um, leadership role, I guess, in helping to establish with one of our community partners who it's kind of like a coalition that we're a big stakeholder in. It's activated Allen County. We kind of put a big part in leading to help prop up what we call a newcomer coalition. So a coalition that essentially meets and you have different representation, right? You have healthcare, you have education, you have legal, right? You have job and family services. You have all these folks coming together. Um, and we were also able to help or through support through our system, through our foundation to get funding to provide basically somebody kind of run as an administrator, a point person um, within the community to kind of be that point person when somebody comes in with a need, right? That they can point them to if it's a housing concern, if it's a job concern, if it's maybe an educational thing or healthcare concern, kind of point them to the right direction. And then we also were able to get an organization called Connecting Borders in as well. And so they kind of have like a physical location here in Lima, and they kind of serve as the point person. So or the point organization, I guess, to kind of connect those newcomers that are coming into opportunities.
Nice. That's really, really great. And then
Yeah,
what benefits are we seeing on the hospital side from these things? Can we talk a little bit about why and what the motivation is aside from the governmental, kind of
sure.
requirements to be, yeah.
Yeah, I mean, I just think about like over the last year, just the amount of minutes that we had to do for translation services was really, really high. We've actually seen some of those numbers decrease. And so I don't know if that's due to those individuals getting care at the right place at the right time. For example, um, we have a graduate medical education center. So we have residents, provider residents, right? So we have family medicine, internal medicine, emergency. And so our resident clinic, which is family medicine, it's kind of not like a safety net, but it's kind of the spot where we would serve a lot of those patients, right? And so so from that standpoint, I would say initially there was a lot of confusion of, maybe the staff didn't have like the scope, or we didn't have support to, they may be presenting some other cultural or socioeconomic barriers that uh, maybe prolong like how we could provide them access or care or anything like that. But I feel like those needs have been alleviated to a certain extent, and we've been able to kind of provide more wraparound services. If it's like a language line, if it's maybe a community health worker, if it's establishing a OB clinic for high risk Haitian mothers and patients. Um, and so, yeah, I mean, I feel like there's been a lot of bits and pieces to that, for sure. And also understand how as a healthcare provider, how we can kind of play a leadership role in that, in the community, understand like, hey, here's what we're seeing within the hospital. Um, what are some opportunities for grants? What are some things that we can kind of come together so that we're not duplicating? Another thing that's just a lot of people won't think of, but just from a labor and delivery standpoint, and it's a cultural thing, but we'd have a lot of mothers who would deliver and would have car seats, right? So we had to think through what that looked like, and how do we, from a legal standpoint, how do we provide car seats on site? You know, so there's a lot of those things that people may not think of, but definitely created a lot of challenges. But yeah, I mean, I would say that through that we've learned a lot about it, and we're continuing to learn a lot about it.
That's a big deal when you think about all those little things and all the little ways, and there's so much incentive too, because we want people to be in our communities to be healthy, and that's really
Mhm.
essential for cost savings as well. I always try to say, people on the roads being, the car seat example, we really want them to continue to be healthy, because it's never good for our community when, from a financial perspective, but especially from an emotional perspective too. It's never good when somebody has some kind of injury or has a condition that's being treated in an expensive way when it could be done in a more cost-effective way. They're really, really important things. I struggle a little bit with understanding, I guess, how you're able to deal with housing and food and all these things when you are spread across rural and then urban. Because looking at Philly, the housing that we provide in the urban area of Philly is a lot different than the housing that's provided way out in Maine, where I, was raised. How
Sure.
do you how do you make sure that the rural communities are equally as cared for? Are you going there and speaking with them in person? What does that look like so that you can really keep your pulse on it?
Yeah, that's a great point. It's very challenging, and it's really about developing the relationships, and yeah, kind of having a good pulse of what are some of the needs. My counterpart, she does a great job too of, from a community governmental business relations standpoint, of propping up advisory groups within the community of leaders. And so I feel like we there's a lot of circles that we're in, and so it's just really developing those strong relationships to understand who are the partners, who are the main, like the key players there. Where are there gaps and opportunities, and maybe that's something that we take to our grant team and we look at to see if there's potential there. Maybe it's propping up a coalition, or maybe it's from a rural standpoint. Those are some of the discussions we're having right now of how can we do some of the stuff that we're doing here in Allen County from a rural standpoint without duplicating, but adding value, right? And not having it to be like another meeting to attend, but um, how can we leverage our resources a little bit more efficiently? Um, so yeah, it's challenging, because then you also have to have a pulse of what's going on within the hospital. What are some of the new services, right? Some of those things, but it's really about developing the partnership and understanding who the partners are. Um, and so, like to your example with the food insecurity, like that's something that um, you know we s- we have a program called the Green RX program, and so it was just a partnership that we had with the food bank here, and they serve 10 counties, and then another organization called Children's Hunger Lines. But essentially, the food bank, what we did is we started with our primary care locations, and strategically started in certain locations where the need was higher, of at least what we were seeing. So our providers, our nurses, our staff would screen the patients when they're going through their assessment. If they identify as being food insecure, we provide them with a shelf-stable food box, emergency food box on site, and then essentially we provide them like a voucher essentially to connect them back to the food bank. So like maybe if they're eligible for SNAP or they're eligible for the distributions, right? We're not going to be the long-term food provider, but we can help address those needs and get them connected. So like that's how I feel like that approach we try to take with a lot of things, whether that's in the family medicine from an ambulatory standpoint or inpatient, to understand is the data and the need that we're seeing within the hospital matching kind of with what we're seeing in the community, because it could be vice versa.
That's
Um,
so important, and that's a great way of really trying to reduce that kind of excess as well, right? And also save
mhm.
time of your time with having, trying to remove duplicated meetings and whatnot. That's so important. What just kind of leave us off? Uh, actually, speaking of the food thing, I think back to like Meals on Wheels, right? In
Mhm.
Philly, you have usually a church that has a kind of an open house where you come and get food, but in the rurals, you switch to maybe more of a Meals on Wheels method where you're maybe delivering it to people. It's interesting. But I want to leave us off with a positive question. What do you think you're looking forward to the most over the next year in terms of things that you'd really like to see implemented or changes in your community that you'd like to see?
Yeah, that's a great question. I think like when in relation to that, like within our chip, we have 7 priorities. There's like 40, 42, 43 different strategies that we measure. And so I'd like to get us to the point where we can operationalize that even more so for efficiencies, and scope, and really have some strong outcomes to show how well we're doing and kind of be like a best in case, like an evidence-based program. Um, and what I mean around that is even more so, we do a ton of outreach, right? We do a ton of outreach. But I would like for people then when they think of Mercy Health of like, oh yeah, they're the leader in this, right? They're in the leader of providing this sort of education or outreach for this population. And and we know that they're the provider of choice then when we're going to the hospital. And so I think what I'd like to see is even a stronger awareness of the programs that we have, right, from a community perception standpoint. Continue to build those strong, strategic partnerships and relationships. I think are really, really important. Um, and yeah, I mean, I think we can dig a lot deeper for some of our investments too. Yep.
Yep, it's hard to get the message out there sometimes because do they have a phone? Do they watch television,
Mhm.
right? And especially when you're dealing with people who are coming from different cultures, they're not going to do what I do, right? Because they're from a different culture. So we need to
Mhm.
learn, what do they watch on television? That's a big deal. I mean, how do you even find out where to message certain people? How do you like what methods are you using to get a hold of them and get them that information?
Yeah, there's a lot of different ways that we do that. I mean, like I said, we have a community health coordinator. She's been fantastic, doing really kind of what we call like health needs assessments initially. So strategically going to locations, holding events, um, providing opportunities for these individuals to just provide us a survey. Basically, go through of identify, do they have a provider? What insurance do they have? Do they have issues with housing, food? All those different barriers or challenges that may present for somebody showing up in the hospital. Um, and then she would follow back up with them. So she would connect with them such and such time, connect them either to a community resource or maybe a resource back at the hospital department. So it could be something like somebody may not have a provider. We may connect them to a resident clinic, or somebody may have been a longtime smoker and they'd like an opportunity to do a low dose CT lung cancer screening, like any of those things. And it may not be us as the most appropriate. We may refer them to a partner who has more bandwidth. So like maybe within housing, we refer them to a shelter, or then we in turn work with that shelter or that organization and say like, okay, like this is kind of like putting the band-aid on what programming can we put out that's going to be a little bit more sustainable. So I think that's another big thing is, we really try to, a lot of the programs that we do, we really try to make sure it's not just like, hey, we're going to introduce it. If the funding's gone, it's no longer here, right? How can we show that um, we're providing strong impact and outcomes so it can be sustainable? And then how can we diversify some of our funding streams, right? To kind of keep that propped up and running long term. So those are like, I mean, those are challenges with anything, right? So those are the things that
That's
you
a
always
great
have to think
approach
through. Yeah,
because you're not just saying, okay, here's an emergency shelter, bye. All right. You're saying, okay,
yeah,
this is a temporary solution, but how can we get employment? How can we get education? How can we get all this other stuff going?
sure.
And then how can we make sure that it's available long term? Really important. Thank you so much, Tyler, for coming on. I appreciate your time. It was really interesting talking about this. There's so much worry and concern out there, and so it's great to have some, discussion on good things that people are doing and really impressive
Yeah,
work that you guys are doing there. So thank you for your time.
I appreciate it. Thank you. But thanks for asking me to be on. I've enjoyed it.